Hi everyone, Ashlyn Giza YouTube channel. Today I'm going to talk about ulnar impingement syndrome. The reason why I just chose to talk about this is because in my previous video I talk about different hospital visits that I had. And one of them was about ulnar impingement syndrome. So basically I was in pain for like 2 weeks and I was told by an ER doctor to rest for 2 weeks. um, don't use that hand. Take ibuprofen or Tylenol as needed, and just ice it and heat it. So I did that. It didn't work. I went back to the ER and I kind of had a bad experience with the doctor. They weren't really wanting to do an x-ray or anything like that. So I went to a different clinic. I got an x-ray done, and it showed that I had ulnar impingement syndrome, and I had like a shortened ulna, which is a bone. Like I had something shortened in my wrist, and it caused my wrist to have extreme pain, and it caused clicking too. So if I rotated my wrist like this in a circular motion, it would cause a lot of pain. And I do a circular motion a lot because I actually paint. I'm an artist, so um, I paint a lot and I use my wrist a lot, so and hands. So they actually had to make a cast. They molded my arm, made a cast, told me to sleep in that cast at night and try to sleep with my arm on pillows to have it be above my heart, and take Tylenol and ibuprofen for pain, and um, ice it and heat it and just do that. And if it got any worse and stuff like that, then surgery was the next step. So hopefully I don't have to do surgery ever, but unfortunately, the older we get, the more wear and tear on our bodies, just like cars. So yeah, it's a confusing thing. So if you're having wrist pain and you don't know what it is, that's why I'm making this video, because a lot of people mistaken it for tendonitis because it feels similar to that pain, like tennis elbow or tendonitis, but it's not. That's not what it is if it's pain that lasts longer than if just a few weeks. So um, of course, go to your doctor, get assessed, try to ask for an x-ray, and mention, the possibility of ulnar impingement syndrome, because doctors are human and they're really busy, so sometimes it doesn't always come to their mind. So talk and ask about that as well. And I'm going to make this video short today because I'm not feeling well. I'm actually going to make another video really quick right after this to tell you guys why I'm not feeling well. But anyways, so that's a little bit about that. Ulnar impingement syndrome. So basically, the next step treatment, if like all the cast thing doesn't work and ibuprofen and stuff, is surgery. So hopefully, I'll never have to do that. But yes, if you guys have ever experienced any wrist pain or injuries or anything like that, drop the comments below. I do know that I did injure the same wrist, this same wrist on my right arm, when I was younger. I was I was monkeying around on a bunk bed, and I fell and landed on my wrist funny and fractured my bone in my wrist. So I'm thinking that kind of has to do with kind of what's going on with my wrist too. But um, I know that it's also a different situation too. But I feel that kind of egged on the pain in my wrist too. So, but anyways, I will be on shortly again with another life topic. Thank you guys.